worked in a primary care clinic for about a little over a year, and then an OBGYN clinic as a medical assistant. And I also did some medical missions abroad.
My previous patient care experience was being a medical assistant at an orthopedic clinic office. I got to do a lot. I got to set up injections, assist in minor procedures, and got to interact with a couple PAs and a lot of doctors as well. I also got to observe surgery, which was really cool.
My previous experience, I started as a CNA, and I hated that. So I became a phlebotomist in a hospital. So I got to deal with like ER all the way to babies and everyone else in between. And it was a good experience, although some others have like EMT or something like that. I still think it was a good experience to deal with patients.
So before I got into PA school, I actually worked at a physical therapy clinic, and I was a physical therapy tech, so I'd help out with the gym and help out with the patients doing cryotherapy and stuff like that.
My previous patient care experience, I used to be an EMT, and I was an ER tech at a hospital.
I worked as a surgical tech, both prior military and civilian, for 26 years.
I started off as a CNA, and then I had a job as a phlebotomist in a hospital, and then I had a volunteer position in a hospice, so I was working with patients there, and then I had a, had a volunteer position in an ER as a EMT assistant, and then I got a position as an EMT in a hospital, and then I was a patient volunteer rep as a counselor assistant for addictions counseling.
So I originally trained as an EMT, and then I went to PT as a PT aide, and then I ended up doing ophthalmology as a technician there.
What was your previous patient care experience in prior to PA school?
Well, I was an EMT for a while, and then I was a scribe in the emergency department for about 3 years.
I was a medical technician in several clinics and a couple of hospital units.
So prior to PA school, I worked in various fields. I was a scribe in cardiology for over a year. I was an ophthalmology tech for about 8 months, and then I worked in a multi-spec clinic as a scribe, so endocrinology, plastics, and orthopedics.
I was rehab tech at a rehab hospital, so we did a lot of stroke patients, fall patients, things like that.
So for me, you guys know my previous patient care experience was in physical therapy. I was a physical therapy aide for 3 years, and for me it was just a little bit too repetitive, and I wanted to be more at the forefront of providing medicine and care to patients. And so that was my patient care experience. Hope you guys enjoyed this video. Don't forget to be like my blood type, be positive. I'll see you guys in the next one. Peace.